Hello everyone, third question. We can see here that they have asked us a question that identify the semicircular line here. I'm sure if you have attended the lecture by now, you must have guessed it right. We've discussed this in Radiological Anatomy of the Hip, that is lines around the hip, and this is what is called as Shenton's line, but that's not enough. We have to talk about the remaining lines as well. So a clear-cut X-ray in front of you, a pelvic X-ray with both the hip joints, immature skeleton. You can see this red color horizontal line which is connecting center of one acetabulum to the center of another acetabulum, and this red color line, what you can see here is called as Hilgen-Riener's line. Now apart from that, what is its value? I'll tell you in a while, don't worry. Now apart from this, I want you to see that this is the superior acetabular margin, and you can see that there is a line coming as perpendicular from superior acetabular margin as perpendicular to Hilgen-Riener line. And if I extrapolate this line here, then this line is something which becomes what is called as Perkins line. So from superior acetabular margin, the line which comes as perpendicular to Hilgen-Riener line is what is called as Perkins line. Now I'll tell you the significance of Hilgen-Riener line and Perkins line is that when these two lines intersect each other, they create something which is called as Perkins quadrant. I will show you the four quadrant: inner, lower quadrant, inner, outer lower quadrant, outer upper quadrant, inner upper quadrant. So you can see the four quadrants here. Now before I go further, you should know that the normal location of the head of the femur, inner or lower quadrant, but if you're talking about congenital hip dislocation, the head of the femur shifts from inner lower quadrant to the head of the femur. I'm sure in a normal hip joint you can see it is in the inner lower quadrant, but if the hip is dislocated, it shifts from inner lower quadrant to upper outer quadrant. It shifts from inner lower quadrant to upper outer quadrant. So far so good. I can show you one more line here which is drawn basically here in the form of a dotted line. So you can see this line here. You all can see this line here. So this line, what you saw just now here, is connecting the inferior margin of the superior pubic ramus. The superior pubic ramus, the inferior margin, it is being connected to the medial aspect of neck and shaft of femur. Now this line, what you see here, is actually not a line, more of an arc, which is what is called as Shenton arc, which is absolutely continuous, normal. But if you draw the same Shenton arc on the opposite side, you can see that this Shenton arc is kind of broken. It is kind of interrupted. Why? Because the hip is having congenital hip dislocation. So this frame of screen which you have right now is one of the most important frames for MCQs on Radiological Anatomy of the Hip, which includes lines around the hip, where not only we talk about Shenton's arc, we talk about Hilgen-Riener line, we talk about Perkins line, we talk about Perkins quadrant. I wish you all the best.